Hello everyone. My name is Docsaab and today I will be presenting a comprehensive report on furosemide, a widely used loop diuretic. This presentation aims to provide a detailed overview of this important medication. To start, let's establish some foundational knowledge about furosemide. It is a primarily classified as a loop diuretic, a term that refers to its mechanism of action within a specific part of the kidney. It is often referred to as a water pill because its main function is to increase urine production, helping the body get rid of excess salt and water. This is crucial for patients experiencing fluid overload. You might encounter furosemide under various common brand names such as Lasix, which is perhaps the most well known, as well as Furosix, Diaqua 2, and Low Aqua. It is primarily therapeutic uses are quite broad and impactful. Firstly, it's a cornerstone in treating edema, which is the medical term for fluid retention. This includes edema associated with conditions like congestive heart failure, where the heart isn't pumping effectively, liver disease such as cirrhosis with ascites, where fluid accumulates in the abdomen, and various kidney diseases, including nephrotic syndrome. Secondly, furosemide is also vital in managing high blood pressure or hypertension, often used alone or in combination with other antihypertensive agents. Furosemide is available in several formulations to suit different clinical needs, primarily as oral tablets and oral solutions. Moving on to the fascinating mechanism of action of furosemide, this is where we understand its potency. Furosemide exerts its powerful diuretic effect by acting on the kidneys at both the physiological and cellular level. Its primary pharmacological effect is the direct inhibition of active chloride reabsorption in a very specific part of the kidney called the thick ascending limb of Henle's. More precisely, furosemide directly targets and inhibits the sodium potassium chloride cotransporter located in the apical membrane of the cells within this thick ascending limb. This region is critical for sodium permeability and is responsible for reabsorbing a significant portion, about 20 to 25% of the filtered sodium chloride. What's important to note is that this part of the ascending limb is impermeable to water but permeable to sodium, playing a vital role in creating the necessary hypertonic medullary interstitium for subsequent water reabsorption. By blocking this cotransporter, furosemide effectively prevents the reabsorption of sodium, potassium, and chloride ions. This leads to substantial increase in the excretion of these electrolytes and consequently a significant increase in water excretion in urine. This rapid and potent action makes furosemide exceptionally useful in emergency situations such as acute pulmonary edema or severe congestive heart failure, where quick fluid removal is paramount. Now let's explore the pharmacokinetics of furosemide, which describes its journey through the body from when it's taken until it's eliminated. First, absorption. After oral administration, furosemide is absorbed rapidly but often incompletely. Its oral bioavailability can be vary widely, ranging from approximately 11% to 90%, with an average of about 65%. This variability can sometimes lead to inconsistent therapeutic outcomes. When given intravenously, its effects are typically seen within just 5 minutes, whereas oral administration usually takes about an hour for effects to commence. Next is distribution. Furosemide is highly bound to plasma proteins, predominantly albumin. This binding is crucial because it facilitates its transport to the kidney and subsequent tubular secretion, which is its prerequisite for its diuretic effects. The volume of distribution is reported to be around 9 liters. Regarding metabolism, specific details on furosemide's metabolism in humans are less emphasized in pharmacology as its primary elimination pathway is through the kidneys. Finally, excretion. Furosemide is primarily eliminated via renal excretion. Its half-life is relatively short, approximately 1 hour. This rapid excretion is consistent with its potent but generally short-acting diuretic effect as it directly promotes the excretion of salt and water. The total body clearance for furosemide is reported as 7 liters per hour. Let's move on to the approved indications and recommended dosages for furosemide, which are critical for its safe and effective use. Furosemide is approved for several important clinical conditions: edema associated with congestive heart failure, edema resulting from liver scarring, including ascites, edema due to kidney disease, including conditions like nephrotic syndrome, high blood pressure, or hypertension. It also serves as adjunctive therapy in acute pulmonary edema, where its rapid diuretic action can be life saving. For a typical adult dosages, particularly for oral administration, for edema related to conditions like CHF, liver or kidney disease, the initial dose is generally 20 mg to 80 mg daily. This can be adjusted based on the patient's response, with the maximum doses potentially reaching up to 120 mg daily for severe heart failure. For hypertension, the oral dose is typically ranges from 40 mg to 80 mg daily, and it can be used alone or in combination with other antihypertensive medications. In acute pulmonary edema, furosemide is obtained administered intravenously, and in initial doses can vary significantly depending on the patient's condition and the urgency of the situation, aiming for rapid diuretic effect. Regarding dosages, forms, and strengths, furosemide oral tablets are commonly available in 20 mg, 40 mg, and 80 mg strengths. Oral solutions and injectable forms are also available for specific clinical needs. Understanding the side effects and adverse reaction for furosemide is paramount. Given its potent nature, while highly effective, it can lead to various effects from mild inconvenience to severe complications. Let's first look at the common side effects. Naturally, patient will experience increased urination. Other common effects include thirst, dizziness or lightheadedness, and dehydration if fluid intake isn't managed properly. Perhaps the most significant common concern is electrolyte imbalances, specifically low levels of potassium, sodium, and magnesium. Patient may also experience low blood pressure or hypotension. Now for the severe side effects and adverse reaction which require immediate attention. Profound diuresis, excessive fluid loss can lead to severe dehydration and profound electrolyte imbalances, posing serious health risk. Electrolyte depletion, this is a major concern. Significant renal loss of sodium, chloride, calcium, magnesium, and potassium can lead to severe hypokalemia, hyponatremia, and hypomagnesemia. Such imbalances can result in cardiac arrhythmias, muscle cramps, and profound weakness. Hypotension and syncope, excessive fluid loss can cause sharp drop in blood pressure, leading to orthostatic hypotension, severe dizziness, and fainting. Ototoxicity, in rare cases, especially with high doses, rapid intravenous administration, or concurrent use of other ototoxic drugs, furosemide can cause transient or even permanent hearing impairment, including tinnitus. Renal impairment, while used in kidney disease, severe dehydration due to furosemide can paradoxically lead to acute kidney injury or worsen existing renal dysfunction. Metabolic disturbances, these can include hyperglycemia, hyperuricemia, and changes in lipid profiles. Allergic reactions, rashes, itching, and photosensitivity are possible. More severe reactions like anaphylaxis are rare but can occur. Gastrointestinal disturbances, nausea, vomiting, diarrhea, or pancreatitis have been reported. Hematologic effects, rare instances of blood discrease such as anemia, leukopenia, and thrombocytopenia have been noted. There are important contraindications and precautions to consider before prescribing furosemide. Let's begin with the contraindications, situations where the drug should absolutely not be used. Anuria or complete renal shutdown. Furosemide is ineffective if there is no urine production and can actually worsen fluid overload. Hepatic coma or pre-coma. The rapid fluid and electrolyte shift induced by furosemide can precipitate or worsen hepatic encephalopathy in these vulnerable patients. Known or suspected electrolyte imbalance, hypovolemia, dehydration, or hypotension. This condition must be corrected before furosemide therapy is initiated, as the drug can severely exacerbate them. Hypersensitivity, patients with known allergy to furosemide or sulfonamide derived drugs should not receive it due to potential cross reactivity. Jaundice, newborn infants or infants with diseases that can cause jaundice. specific consideration for these very young populations are in place. Now for precautions, situations where furosemide can be used but with extreme cautions and close monitoring. Patients with hepatic cirrhosis and ascites, therapy should ideally be initiated in hospital setting with strict observation. This is due to the high risk of precipitating hepatic coma from rapid fluid and electrolyte changes, renal impairment. Close monitoring of renal function and electrolyte imbalance is absolutely crucial as furosemide can further affect kidney function and lead to severe fluid and electrolyte disturbances. Diabetes mellitus, furosemide can cause hyperglycemia, so careful monitoring of blood glucose levels is necessary for diabetic patients. Gout, because furosemide can cause hyperuricemia, it has the potential to trigger gout attacks. Systemic lupus erythematosus, cautions is advised in patients with SLE as diuretic can sometimes exacerbate these conditions. Sulfite sensitivity, it is important to note that some furosemide formulation contain sulfites which can cause allergic reactions in susceptible individuals. Furosemide has a significant potential for drug interactions. There are over 500 known drug interactions, including many moderate and some major ones. Let's highlight some significant drug-drug interactions. Aminoglycoside antibiotics. Concurrent use greatly increases the risk of ototoxicity, which is damage to the inner ear leading to hearing problems. Non-steroidal anti-inflammatory drugs. NSAIDs can reduce furosemide's diuretic and antihypertensive effects and increase the risk of renal dysfunction. Lithium. Furosemide can decrease the renal clearance of lithium, leading to increased lithium levels and potential toxicity. Close monitoring of lithium levels is essential. Cardiac glycosides like digoxin, furosemide-induced hypokalemia can potentiate the toxicity of digoxin, significantly increasing the risk of cardiac arrhythmias. Antihypertensive agents, furosemide can enhance the effects of other blood pressure lowering drugs, potentially leading to severe hypotension. Corticosteroids, co-administration with corticosteroids can increase the risk of potassium depletion. Diabetes medications, furosemide may decrease the effectiveness of anti-diabetic drugs by potentially increasing blood glucose levels. Nephrotoxic agents, concurrent use with other drugs known to be harmful to the kidney can increase the overall risk of kidney damage. Probenecid, this medication can reduce the efficacy of furosemide by inhibiting its tubular secretions. Phenytoin can decrease the diuretic effect of furosemide. Beyond the prescription drugs, there are also interaction with the food, herbal remedies, and alcohol. Food. Furosemide can generally be taken with or without food. However, it is advised to take it consistently at the same time each day for optimal effects. Alcohol. Concomitant use with alcohol can lead to addictive hypotensive effects, causing symptoms such as headache, dizziness, lightheadedness, and fainting, especially at the start of treatment. Herbal supplements. Certain herbal diuretics such as dandelion, uva, orsi, juniper, buchu, and hibiscus can potentiate furosemide's diuretic effect, leading to excessive fluid and electrolyte loss. Nutrient depletion. It is important to remember that loop diuretics, including furosemide, can cause the loss of important nutrients like potassium and magnesium from the body. Next, let's consider the use of furosemide in specific patient populations where unique consideration and precautions apply. In pregnancy, human data suggest a relatively low risk for furosemide administration during the pregnancy, although it may elevate serum uric acid levels. However, its use is generally advised only if the potential benefit clearly justifies any potential risk to the fetus, as some authorities may even consider its use is contraindicated during pregnancy due to limited comprehensive data. In breastfeeding, furosemide is generally considered compatible with breastfeeding, especially at lower doses such as 20 mg daily, which typically do not appear to suppress lactation. However, higher doses could potentially lead to intense diuresis in the mother and might decrease milk supply. For newborns or preterm infants, an alternative drug might be preferred. In pediatric patients, furosemide is used to treat conditions like edema in children. The doses must be very carefully determined by healthcare provider, taking into account the child's weight, age, and specific medical condition. Close monitoring for electrolyte imbalances and fluid status is absolutely crucial in this population. Finally, for geriatric patients, Elderly patients are often more sensitive to the effects of furosemide due to age-related physiological changes, multiple comorbidities, and polypharmacy. They are at an increased risk of dehydration, hypotension, and significant electrolyte disturbances. Therefore, lower initial doses and careful ongoing monitoring of fluid balance, electrolyte levels, and renal function are essential to ensure their safety and efficacy. Understanding furosemide overdose and its management is crucial in emergency situations. The symptoms of overdose include profound diuresis, this means excessive and rapid urine production leading to significant fluid loss, severe dehydration, patient will exhibit intense thirst, dry mucous membrane, sunken eyes, decreased skin turgor, and general weakness, electrolyte imbalances, critically low levels of potassium, sodium, and chloride are common. These imbalances can quickly lead to dangerous cardiac arrhythmias, muscle cramps, weakness, and even paralysis. Hypotension, a significant drop in blood pressure causing dizziness, lightheadedness, fainting, and potentially leading to shock. Acute renal injury due to severe dehydration and electrolyte imbalances. Kidney function can be severely compromised and leading to acute kidney injury. The management strategies for toxicity are primarily supportive as there is no specific antidote for furosemide overdose. Immediate intravenous administration of fluids and electrolytes is critical to correct dehydration and rapidly restore electrolyte balance. Maintaining adequate blood pressure is paramount. These may involve additional intravenous fluids and, if necessary, a vasopressors to stabilize circulation. Close and continuous monitoring of vital signs, fluid balance, urine output, serum electrolytes, and renal function is imperative to guide treatment. The administration of furosemide must be stopped immediately upon suspicion of overdose. Any specific symptoms that arise, such as cardiac arrhythmias, should be addressed promptly with appropriate symptomatic treatments. Finally, effective patient counseling is essential for safe furosemide use. Patients should take it exactly as prescribed, ideally at a consistent time daily, with the last dose by 4 p.m. to avoid nocturia. They should monitor their weight daily and report significant changes and expect regular blood tests for electrolytes and kidney function. It's important to be aware of side effects like dizziness and dehydration and to report any severe symptoms, especially those of electrolyte imbalance. Maintaining adequate fluid intake is important unless advised otherwise. Patients should discuss potassium intake with their doctor and inform them all medications and supplements to prevent interactions. They should also avoid alcohol due to the increased risk of low blood pressure and dehydration. And importantly, never stop the medication abruptly without consulting their doctor. In conclusion, furosemide remains a cornerstone medication for managing conditions characterized by fluid overload such as edema in heart failure, liver disease, and kidney disease, as well as hypertension. Its potent action stemming from its specific inhibition of sodium potassium chloride cotransporter in the loop of Henle leads to effective diuresis. However, the use of furosemide demands extremely careful clinical judgment due to its potential for significant fluid and electrolyte disturbances, hypotension, and range of other adverse effects. A thorough understanding of its pharmacokinetics, along with the diligent monitoring of patient responses, especially in vulnerable populations like the elderly, pregnant, or breastfeeding individuals and pediatric patients, is paramount. Awareness of its extensive drug interaction profile is crucial to prevent adverse outcomes. Ultimately, comprehensive patient education on administration, potential side effects, and monitoring parameters empowers patients to use furosemide safety and effectively. The careful balancing of its powerful therapeutic benefits against its inherent risk underscores the importance of individualized patient care when prescribing and managing furosemide. Thank you for your attention, guys. I am now open to any questions you may have via comments, and please like, share, and subscribe to the Docsaab's Diary.